All right, well, being mindful of time, I think we can go ahead and get started tonight. Thank you very much, everyone, for being here. I suspect folks will continue to join as we get going, but I will kick things off. So everyone is aware we will be recording the presentation and the Q&A for tonight's session. Moderating our session tonight is Dr. Robert McClellan. He is a professor of medicine emeritus, community and family medicine at the Dartmouth Institute for Health and Policy and Clinical Practice at the Geisel School of Medicine at Dartmouth. He will be introducing Dr. Sawin and moderating the Q&A. So Bob, you can take it away.
Thank you, Emily, and thank you all for joining us on this almost Earth Day Eve webinar on multi-solving the climate solutions that improve health and equity, co-sponsored tonight by the New Hampshire Public Health Association. I'm absolutely delighted to present to you the individual who's going to be talking to us about this tonight, Elizabeth Sawin. She is a biologist with a Ph.D. from MIT and has been trained in system dynamics and sustainability with Donella Meadows and worked at Meadows Sustainability Institute for some 13 years. Her work has been widely published, including in the nonprofit Quarterly, the Sandford Social Innovation Review, U.S. News, the Daily Climate, System Dynamics Review, and much, much more. She's trained and mentored global sustainable leaders in the Donella Meadows Fellows Program and provided systems thinking training to both Ashoka and Dalai Lama Fellows. Since 2014, she's participated in the Council on the Uncertain Human Future and is also a member of the advisory board to Kresge Foundation's Climate Change, Health and Equity Program. Most germane to tonight, she is the co-founder and co-director of Climate Interactive and an expert on solutions that address climate change while also improving health, well-being, equity, and economic vitality. She coined the term multi-solving to describe such win-win solutions. Building on the work of Climate Interactive, she launched the Multisolving Institute just 2 months ago to provide research, tools, and stories that help accelerate multi-solving. I personally have used tools and simulation games available on the Climate Interactive website and have found them incredibly engaging for my public health students. And multi-solving is just the kind of approach we need, I think, to engage a broader swath of the public. So I'm very excited to hear what Dr. Sawin has to say. She'll speak for about 30 minutes, after which we'll have about 30 minutes of Q&A. Please post your questions, comments, and relevant resources in chat throughout this hour. I'll compile them and present as many of them as possible. And with that, I'll turn it over to you, Dr. Sawin.
Thanks so much for that introduction. I really appreciate it. And thanks for the invitation to be here. I'm going to just launch right in and share my screen. I have a few slides to share with you all. Let's get those nice and big so you can see them. Someone give me a thumbs up. Is it all working? Thank you. Yes, so we're going to talk about multi-solving, but I like to find a way to introduce ourselves and things like this. I think we all sit in front of these screens and we see each other in these little boxes, and I know it helps me be a better presenter to feel a little more connected. So I have a habit of asking a question, and we use this tool. Some of you have probably seen this in other webinars, Poll Everywhere it's called. And Emily, you could put the link in the chat. So throughout my 30 minutes, we'll pop into Poll Everywhere. It's a way we can do quick little multiple choice polls, or you can give me some feedback on things. So if you all go there while I'm talking, the first question, my thought of our introductory question today is, what's something precious to you that's at risk from climate change? Why are you here at 6 p.m. on a Tuesday when you could be doing lots of other things, I'm sure? And I'll answer while you all head to the poll. Actually, you know what I'm going to do? I'm going to go to the poll because I realize I need to turn it on or it won't work for you all. Okay. So I'm going to give my answer while you give yours. The two things that are most precious to me at risk of climate change are my two daughters, two young women in their early 20s. One of them, pictured here, is a chef, and she's building a school bus of literally, you know, welding an old rusted school bus back together, basically, for her business that uses local food to make, local products from local farms to make really amazing food. And her sister hikes to the top of Mount Ascutney once a week. Many of you probably see Mount Ascutney from New Hampshire. And she lives with her partner in Wethersfield, where they have a little homestead. So pretty much everything all these people and their friends are doing, you know, is going to play out in the climate that we're one way or another sealing the fate, the relative manageability or not in this decade that we're in right now. So we'll see if that's not what I expected. Give me a second, folks. Something went a little funny there. Okay, thank you for who found your way. My 8-month-old granddaughter, my children's health, powder days, my son's future. Yeah, there are our kids and our grandkids, right? Future for my grandchildren, my children, our winters, our local food systems. Yeah, there's a real multi-generational imperative to what we're talking about tonight. Physical and mental health of our family and other families, all the other species, right? The coral, the redwoods, 1-year-olds, the oceans and the life in them, ocean acidification, 2 daughters. Yeah. So thank you for that. I really appreciate you giving me such heartfelt, honest answers there. If you'll stay right there and pull everywhere. My second question of this sort of introductory moment is just help me see who all is here. I'm just curious, how many of you think of yourselves as healthcare as your primary interest? How many of you think of it as climate? Maybe both. So you should be able to answer that, and we'll see it hop around for a minute. I see kind of mixed of all, I'd say 1/3, 1/3 almost. Perfect. So that should really set us up for a great conversation, because we're talking about today this intersection, and obviously it's in the name of your organization, of these two incredibly important issues. So I want to introduce the word. Maybe this is the third part of the introduction. So what we care about, kind of what perspective we're coming from, and then the theme for tonight, multi-solving. The definition I use is using one investment of time or effort to solve several problems at once. And Bob mentioned our new institute, a couple months old now. We think of ourselves as a think, do tank that encourages people to multi-solve, and we do what we can to make multi-solving easier for them. So normally I lead up to this report and kind of explain it to people, but I have a feeling many of you might know this more than the typical audiences I talk with. So I thought we'd do it as another quick little poll. A report from the World Health Organization came out last November, and they compared the cost of being on track to Paris climate goals with the health savings from being on track to Paris climate goals, from the decarbonization that we would have to do. And I want you to guess on the next poll, what do you think the World Health Organization said? More than outweigh, about 1/3 costs higher than savings, or the costs are twice as high as the health savings? So I see some votes for more than outweigh. Maybe it's a little bit more. Maybe the costs are twice as much. We're getting a little bit of a preponderance for A. Give it one more second. And this is one of those times where we say the A's have it. So this is what the World Health Organization said at the end of last year. The public health benefits resulting from ambitious mitigation efforts would far outweigh their costs. And Emily, you have the link to that study. I bet folks who might be interested, you could throw it in the chat. And I think many of you, know why this is. So what is the World Health Organization measuring in terms of health savings? Well, there's two main categories. The biggest one is the just the fact that there would be less of all the illnesses caused by air pollution, from respiratory illness, cardiovascular disease, dementia, premature birth. All these things are more and more convincingly being linked to the fine particulates that come out of fossil fuel combustion and end up inside people's bodies. The second reason is, so that's what's missing in a world that's on track for climate, is all that air pollution. What's present is likely a lot more physical activity as we make our communities more walkable, safer to walk and bike. And so there's a second health benefit there, as you all know, which is just more people getting recommended amounts of physical activity, less of the chronic diseases that come from a lack of physical activity. So this is amazing to me, good news from the World Health Organization. I talk about it everywhere I go, and I'm amazed at how many people haven't heard of that report. Maybe in the chat we can hear how many of you knew about it. It comes out the same time of year as the IPCC report, but gets way less attention. And this synergy, the fact that the health benefits outweigh the energy transition costs, is really important, because we are really stuck, as you know, at getting over the hump of this energy transition. And I wanted to give you two more headlines from last month. They were about 8 days apart, and they really hit me kind of, shot chaser, basically. So March, IPCC says any further delay in concerted anticipatory global action on adaptation and mitigation will miss a brief and rapidly closing window of opportunity to secure a livable and sustainable future for all. And I know many of you are scientists, right? And so language like that coming out of the mouths of scientists, a livable and sustainable future for all, is about as serious as much of a kind of, sirens blaring warning as scientists ever give. 8 days later, the International Energy Agency reported on last year's emissions, 2021's emissions. They said energy-related CO2 emissions grew to 36.3 gigatons in 2021, a record high. So we bounced right back from any emissions reduction associated with the pandemic in 2020. So we have hardly any time, the IPCC says, and the IEA says we're still going in the wrong direction. The potential of putting together, what we need to do could pay for itself on the health side is, to me, one of the most promising strategies for getting us through this transition, why your community is so important. And yet, this is from the same report from the World Health Organization. They looked at this and they found only 1 in 5 countries analyzed the health co-benefits in their national climate policies. So 20% at the national level are linking these issues at all. 13% of NDCs, so that's the each country's pledge to the United Nations to reduce emissions. Only 13% of them measure health co-benefits, even though the World Health Organization is stressing, how important this connection is. So there's a tension there. We need so urgently to act. Things are going in the wrong direction. There are synergies that really could present a way forward and help overcome some of the inertia, but by and large, we're leaving the synergies on the table. And it's not just at the the level of nations and internationally. This is just a picture of a park to remind me to just mention a story. I see this at the level of communities all the time, and I'm thinking of a guy I met in Atlanta whose job was to procure land for conservation and parks and green space. And what he noticed was every time they did that, the property values around the parks increased. And what did that end up doing? You can mentally simulate what would happen, right? Property values go up. These were efforts to make a difference in marginalized or disinvested communities, to give them a new, more green amenity. And then the people who live there maybe for decades couldn't afford to live there anymore. Gentrification, it's even got a name now. It often gets called green gentrification. And so that same feeling of a potential synergy, like, green space is another multi-solving solution that helps fight the urban heat island effect. It helps absorb stormwater runoff, which is getting to be more of a problem with climate change, has all kinds of benefits for physical and mental health. And it could really improve the conditions on the ground for under-resourced communities. But then it has this flip side of where it actually undoes all the good that people are trying to do. And this guy I met who worked in parks, he was just so frustrated because he said, I know parks, I don't know affordable housing. I don't know anybody who works in affordable housing, but I can see that to do a park really the right way, we should be partnered with affordable housing before we even get started, right? Because as soon as the word gets out about a project like this, there's a wave of speculation and it's kind of all over. So in all these cases, the common obstacle, I would say, in my assessment, is the silos that we've created in our world make it impossible for people to act in ways that they want to, in ways that make common sense, in ways that could solve a lot of problems. So we're going to get to the obstacles, and I want to hear your thoughts on them. But I will just name at least 4, and there's probably more reasons to multi-solve. The first one is to align budgets, and we've kind of been talking about that, right? That for the whole system, if the health side saves more money than the energy system costs, there's a potential to move forward. There's the possibility of aligning constituencies. I led a project in Milwaukee, Wisconsin a few years back, and at one of our meetings about multi-solving, I was from out of town, Vermonter in Wisconsin. It was the first time that someone from the Children's Asthma Coalition and the Riverkeeper organization had met, even though the strategies they were both pursuing, one to keep the water clean and one to help children, they were pursuing some of the same strategies, but they'd never met in the same city. So multi-solving done right can create those kind of alliances. And that's what we need if we're facing big vested interests like fossil fuel interests who are trying to hold things in the status quo. We need more power, more alignment. Multi-solving can do this interesting union of short-term and long-term goals. So if you shut down a coal-fired power plant, the air quality improvement is going to be pretty immediate. It doesn't take long for PM 2.5 to get washed out of the air. All the health benefits will come fairly quickly after that. The climate benefits might be decades out. And of course, the air pollution benefits are local, the climate benefits are global. And we know that for politicians, it's much easier to move forward on the short term and the local than the long term and global. So by multi-solving, by bundling these issues together, we also open up maybe some room for political maneuvering. And then the fourth issue is to address inequality and inequity. And the way I think about that is, to address climate change, we basically have to rebuild almost everything. And we know that our infrastructure and our policy are not working for everyone. They're very inequitable. You all probably see in the health system, the disparities in health that creates. If we have to rebuild it all anyway, what an opportunity to build it in a way that works, that is equitable, that is just. So when we think about multi-solving, we think about 7 or 8 different benefits, and you can see them here in this picture on the left. We call that FLOWER, and it has an acronym: the Framework for Long-Term Whole System Equity-Based Reflection. And it's a tool for people to think about any project they might do and really challenge themselves, like how many co-benefits could they create? So we start over here, we have climate protection. And let's just talk about this example, which comes from Colombia, the country, where in Bogota and other cities, some of you might know about this project, basically on weekends and holidays, they turn the streets free to walking and cycling. And it's just this massive kind of bike party through the city. That's gonna reduce greenhouse gas emissions. Probably doesn't do a lot that I can think of for biodiversity. Big win for health and well-being, right? People are getting active. Big win for connection, that sense of social community, social cohesion that we know is really important for health and well-being and resilience. And certainly, at least on the days when the project is open, it increases energy and mobility. People are able to get from one side of the city to the other. The other kinds of benefits that we see in some projects are jobs and livelihoods, resilience to climate impacts and other shocks, and cleaner or healthier food and water. So flower started off for us as an exercise with colored pencils and paper. And we've seen kids as young as elementary school take this and run with it. So we give them colored pencils and a project to think of, and then they color in the petals that match the benefits. And to really quickly give you a flavor for that, I set it up so we could try that and pull everywhere. So go back to your links if you would. And we practice on this one, and then we'll do one more. So you should find you're able to click on the petals. And I more or less told you what I think the answer is. So just give it a try. Like, which petals do you think get better in a community that has this level of cycling? I see one person got it to work. So you should be able to drop little teardrops, right? So we're seeing resilience, health and well-being, energy and mobility. Yeah. Great, lots of health. So let's do a second one. I'm going to move you quickly because I know we're trying to save lots of time. This one is a project in New Zealand called Warm Up New Zealand. And it's a project that started off funded by the energy efficiency, I forget the exact name, at the national level, an energy efficiency organization. It did home energy upgrades. And it was started actually as a jobs program. It was after the 2009 financial crisis, and it was meant to get the construction sector back to work. But a really interesting thing happened in that project, which is for some reason, and I don't know exactly why, they brought in a university group who did a health impact analysis on the people who lived in those homes that were being upgraded. And they measured hospitalizations and the costs of medicine for those people and saw a reduction in those costs that were actually like 3 times what it was costing to upgrade the homes. They were keeping people out of the emergency department. And mostly this were people with respiratory illnesses, and cold, damp housing was really bad for their health. So at this point in that program in New Zealand, at the time we did our case study, physicians could basically refer patients for home energy upgrades. And we're seeing that there's examples in the UK that try that too. So yeah, I think y'all are getting the hang of this. Health and well-being, jobs, resilience. A home that's well insulated is going to stay comfortable longer if the power goes out. It's definitely, I think, resilience. Climate protection, because there's just less greenhouse gases to keep those homes warm and comfortable for people. So that's Flower. That's a tool you could find on our website and maybe would help some of you with groups that you talk with. How are we doing on time? 6:24. I'm gonna keep going, but pick up the pace just a wee bit. So those 2 examples, the Siclovia is the name of the project in Colombia, and Warm Up New Zealand, were part of a study that we did when we were at Climate Interactive. It was funded by the Robert Wood Johnson Foundation. They wanted us to do a global scan for projects at the intersection of climate and health. And what we observed, so we found 10 different projects, those were 2 of them. And we saw an interesting pattern when we looked across all these different projects. And that was that multi-solving seemed to happen in a cycle, and that projects would go kind of around and around this cycle. They often started with sensing, and sensing, I would say, is sensing the problem or a problem, but then sensing how problems might fit together. So one thing we say about multi-solving is often our instinct is if we're facing a tough problem to try to make it smaller or simpler. Multi-solving is the opposite. It says if you can't solve a problem, make it bigger. See what you can bundle together in order to bring, remember, those different budgets that you might align or the different constituencies. So there's that sensing of like figuring out what possibly could bundle. Then there's a gathering of how do we bring people together who are champions for all these different issues? How do you get the Children's Asthma Coalition in the same room as the Milwaukee Riverkeeper? That's often a challenging step. Often we hear it's difficult to find the funding for that. It doesn't necessarily look like you're doing anything, but it's critical for the next part of the cycle, which is acting, which is getting those homes insulated, getting the streets open for bicycles, whatever it is. And then the cycle goes back around again, because one thing we found was that most successful multi-solving projects started small, and the way they grew was they measured their impacts and they showed what was changing. And that's how, and so the second thing they're sensing is what's getting better. And they use that information to gather more energy and more partners to them. So like the pivotal moment in New Zealand when they discovered the health benefits, and suddenly it wasn't just a construction sector project anymore, and they had brought public health partners into the mix. So I have a feeling that on this call, there are some of you who have maybe done amazing things in bringing people together across this nexus of climate and health. So I wanted to ask you about this cycle. So I'm going to go to Poll Everywhere again for a second and ask if there's one part of this cycle where you feel like you need the most help. Where would it be? And if you're not sure, that's okay. Just kind of guess. We're just taking the temperature a little bit. So I see acting, gathering, sensing, kind of mixed, but it's true, isn't it? It's sometimes a little easier to see what the problems are and how they could fit together, and then what to do next. Or once you got a group of people together, how to figure out what to do together can be harder. Oh, this is a little side note, but these are two screenshots from that report I told you about. And Emily, I'm pretty sure I put that in those set of links as well. So this is our report on multi-solving at the intersection of health and climate, funded by Robert Wood Johnson Foundation. And there's 10 different projects in there that might especially be interesting to those of you who work in healthcare. So what would I say about obstacles to multi-solving? I mean, we're talking about this tension, right? That everywhere we look, we see synergies in theory, but in practice, the synergies seem left on the table most of the time. In 1 out of 5 countries, the synergies are grasped. In 4 out of 5, they're not. Why is it so rare? I have 5 reasons that I've seen, and I'm going to go through them pretty quickly. One is boundaries, jurisdictional boundaries, physical boundaries. An example I give sometimes is think about a city that's having climate-related flooding problems. And they might have millions of dollars to address it. And the most effective project might be upstream. It might be to restore a wetland way upstream. That's a totally different jurisdiction, another town, another set of political actors. Without some help, even though the pieces of the solution and the resources are there, they're not in the same place, and that makes it harder. Disciplinary silos, where we're trained, I would consider myself, a victim of this as well. Our educational system tends to lead towards specializations, and people who work on health, they start out in different training than people who end up working on climate, and it sometimes gets even more challenging as you progress in your career. Budgets, the way that budgetary decisions are made. We were talking about active transportation and all of those opportunities. Well, you've got this is a state budget for a state in the Northeast. I won't name it, but you've got a wedge of pie for transportation and a wedge of pie for health, and different decision makers are making those 2 decisions, probably fairly independent of each other from what we've seen in the states we've worked with. Inequity, this is at the global scale, but you can drill down all the way to a very local scale. There are some nations that are most responsible for excess emissions. That's the top map. Other nations are most the victim of climate impacts, most vulnerable to climate impacts. Those 2 maps look really different. Without being able to move through all of the obstacles that these inequities create, whether it's access to who's invited into the decision or who has the resources to make the decision, it's really hard to multi-solve. Yet most of us, in my experience, don't feel really equipped to lead groups through those conversations and decisions and readjustments about equity. And there's one more, which is unfamiliarity. You know, put all those first four together, and people who are pressed for time, who maybe don't know or weren't trained in how to act in these complicated and tangled problems. And then just the fact that the stories of this way of working tend to be rare, and then it can be hard to find resources to work in this way. You put all those things together, and I think you start to explain why multi-solving seems to have so much potential, but why so much of the time that potential isn't, at least not fully realized. And so I think I have one more poll. Thank you all for being gracious with these polls. I find them helpful and interesting. So think about your world, and you just get to pick one, I think. It's the way I set it up. So maybe read all the choices. What's the one obstacle you think is the most in your way when it comes to being able to work more in a multi-solving fashion? So time, how to create change, how to connect with people, ways to measure impact. Yeah, they're all tough ones. Give it another minute or two. I'm really pleased to say I can share news we just received today that the Multisolving Institute received a 2-year grant to work on tools to help multi-solvers better measure their impacts, because we see that as one of the main problems. That's choice F there. It's a real apples and orange problem. You're creating benefits in health and equity and climate, and some of them are on a 6-month time scale. You can see the benefits. Others might take decades. How do you show people your impacts when you're working in this very collaborative, very multi-sectoral way? Well, that's super interesting to me. I've never asked this question in quite this way before. And here we have kind of the same theme I think we saw in that last one about multi-solving as a cycle, that identifying the problems that could fit together is actually the easy part. And then finding the time, bringing people together, knowing what to do once you are together, those are the harder parts. I think we're quite close to what I wanted to share. Maybe just to say a few words about our institute. Emily can give you ways to connect us to us in the chat, where multisolving.org is our website, and she'll share our newsletter is the best way to learn about events that we're putting on. But we see our purpose is doing our best to help people who are multi-solving overcome all these obstacles that we've been talking about. And so tools, training, ideas, connecting people into a community of practice so they can learn from each other. And one of our favorite things is just telling some of these stories and sharing the bright spots of what's possible. If you'll indulge me with one last poll everywhere, this is one I like people to think about, and I try to think about it myself, which is, what are the attributes I would need to cultivate in myself to multi-solve? And for this one, it will work best if you just use a word or a short phrase. And we're going to build a word cloud together that will, I think, be a picture of who we have to be as people to work in this way. So taking risks. Collaboration is a huge one for sure. Commitment, humility. One thing we say is that too much investment in the identity of an expert is one of the barriers to multi-solving, that everyone needs to bring their expertise for sure, but we need the kind of experts who are curious about the expertise of others. And humility, getting bigger. The way this software works, maybe it's obvious, but the more times a word is repeated, the bigger it gets. So there's a little consensus forming here about humility. Conversations, inclusiveness, expanding, balance, courage, empathy. Yeah, those are beautiful. Thank you so much. I'm gonna, go back to my slides, but I think that is it. Just thank you. Look to the chat for these links if they're useful to you. And I hope we can keep in touch. I'm going to stop sharing my screen. And I think we have some time for questions.
Well, thank you, Dr. Sawin, for that fantastic overview of the potential for multi-solving and how we can aggregate. I love that idea of taking a seemingly insoluble small problem and making it more solvable by making it larger. That's really an interesting thought. As people are beginning to enter their questions, let me start off with one that's come in already, which is how can we connect the rich healthcare outcomes data with multi-solving initiatives at the community level to show the clear impact of these activities on benefiting health? This is really, it gets to one of your questions and one of the obstacles, and that is how do we actually measure impact, in this case, the health outcomes at the community level?
Yeah, I'm sure I could learn a lot from you all about this. I mostly just have a perspective on how important that is, what you're saying, and how stretched thin already the practitioners I know on the ground are. Even before COVID, the types of groups that are leading a lot of multi-solving work are community serving organizations. They're usually, what would I say, under-resourced. They don't have fancy physical spaces. They don't have huge budgets. They're usually stretching money in all sorts of ways. And they're putting the energy that they have into doing the work, bringing people together, and much less of it into measuring the results. And I can't prove this, but my sense is that it's almost accidental, like this project I mentioned in New Zealand, that happened to have a research element to it. Most on the ground community-based organizations don't have a research university, at their disposal to measure the impacts that they're creating. So I'm back to this idea of learner and expert when it comes to even what can be measured and documented for health outcomes. I'm still a huge learner at that. But what we hear from practitioners is whatever we do offer from that side has to be really simple to do. And so I'm very open to like what that might be, if there even are simple versions that non-health experts could potentially bring to their own work.
I think you speak to the importance of collaboration between community-based organizations and academic centers that might have some of this expertise really in epidemiology and other ways of sorting out cause and effect. I read today that the Biden administration has reversed the prior administration's policy with respect to addressing climate impact of various federal programs. I don't know if you heard about that, but I'm curious what your thoughts are about at the federal level, it could be at the state level as well, of actually saying climate in all policies, in terms of this multi-solving option. If you build a road or you establish an educational curriculum or whatever it may be, if one thinks about climate and the impact on climate, do you think that will expand opportunities for multi-solving and show these connections in a greater way?
Yeah, I mean, I think it's at the federal level, it feels like a mixed bag, and it's hard. It's hard to work at that level, I think. And from the people I know inside that world right now, there's still actually so much recovery from like damage, frankly, by the last administration to just like organizational morale at the EPA or whatever, that I think it's really hard. I guess what I sense in the mixedness of it is we have things like the Justice 40 commitment, right? So in the infrastructure spending, the commitment that what get defined as environmental justice communities. And I think that the definition of exactly what that, how to identify those communities is still being worked out. But the commitment that the benefits shall flow, 40% of the benefits shall flow to environmental justice communities, that is a huge opportunity for multi-solving. And a lot of effort that I see right now is from philanthropy especially, is how can they bolster community-based organizations to be able to access the funding that people are expecting to start flowing? Because I don't know if any of you have applied for federal funding. I'm sure some of you have, but just all the audits and everything else that goes into that. So how to support organizations in doing that. But the potential for it, I've heard environmental justice veterans, who've been working for decades saying, this is a once in a generation opportunity, the amount of money that could flow to impacted communities. And then of course, the biggest opportunity for multi-solving probably wasn't the infrastructure bill, but it was Build Back Better, which had even more expansive vision and, is in limbo as far as I understand. So that's some of the mixed. At the state level, I think there's so much potential. And also our state governments aren't designed to multi-solve. A few years ago, we had an ally in a state, I won't name the state, but the governor had convened a commission to update their climate plan. And it seemed on paper like the perfect opportunity to multi-solve because they had health and human services and transportation and the full coverage of the state. And we had an ally who was one of the people on the commission who knew about multi-solving, proposed bringing us in to help the state make a really innovative multi-solving climate plan. And it didn't get off the ground. And the reason was that it was someone from the Department of Environmental Protection who had been charged with delivering the plan. And that person had a really short timeline. A lot of you clicked time, right, as one of your obstacles. She had to deliver a plan, and the most important thing was to say how much emissions reduction by what year. And she perceived these cross-sectoral dialogues as being time-consuming and putting her objective of an agreement by a certain date too much at risk. So the door never got opened. And that was a few years ago now, and I think things are shifting. But that I think of it as a misperception, the assumption that it will necessarily take longer to engage in multi-sectoral efforts. And that's one of the things that our sort of research agenda at the Multisolving Institute is to really ask that question. Does it take longer? Especially if you count all of the cases where something is pushed through really fast without robust engagement across lots of sectors, and then what happens, right? How many of you have seen projects where, yeah, you got through the first step really fast, and then the community hates the idea, and it's tied up in litigation or people are protesting. So, that kind of go slow to go fast can be a part of multi-solving.
So, given some of the challenges, especially at the governmental level and getting different departments to work together, aligning budgets, et cetera, one of our participants have suggested that libraries might be helpful as a community hub to bring multi-solvers together. I wonder about what you have found is whether or not there is a particular institution within communities that seems to be most effective in bringing diverse groups together to solve multiple problems.
Yeah. Well, I mentioned earlier that Robert Wood Johnson Foundation funded study. And the objective of that, it came from a division of Robert Wood Johnson that is called their global program. So they focus on scanning the world for innovation and bringing that to the health sector in the US. And when we started the project, what we thought was that we would find these really, fascinating projects that could be replicated. And then we thought that's what we were doing. By the end of it, I was really convinced that was the wrong question, because what we found was multi-solving projects were so site specific. They were so dependent on the culture, the people, the particular mix of problems. In systems theory, we talk about how systems are path dependent, like where any system is at one point in time depends on its history. And so even though a great project happened in one place, it doesn't speed up that project happening in another place because it was so dependent on connections and trust building. Like building trust in city A doesn't help city B move any faster, if that makes sense. But that doesn't mean there's nothing that can be learned. It's just we came back feeling that the key scalable unit of multi-solving are attitudes and approaches. So, I'm weaving around to your question about like, is there a particular type of institution? And I think I would probably say no. That we've seen the leaders be in government, outside of government, formal, informal. So we're like, okay, but what's in common? It feels like there's something in common here. And the approach is that cycle, that starting small, iterating, moving at the speed of trust, being responsive to local conditions, stretching across the different silos with kind of a curiosity and a respect. So I think that could start anywhere, and I bet libraries would be amazing, but I don't think it would have to be libraries.
Okay, great. We provided a couple of examples. There's an interest in some specific examples of projects where instituting more sustainable local food systems might improve both carbon footprint issues and health outcomes. Are you aware of any projects like that?
Yeah, in that that scan of 10, there are a couple that were food-based projects. One was in Spain, and it was called Espigoladores, and it was a food waste project. So it was about what they called imperfect vegetables, and it was a bunch of young Spanish, I think maybe recent university graduates who started it, and the initial impulse was food insecurity, and the program worked with families that needed better access to healthy food, and they would glean, so they would go to farms and help harvest any of that imperfect food that couldn't necessarily get passed on to supermarkets. They eventually built like a canning facility and a food processing facility, so it turned into job training at the same time. So that was one. There was a Malaysian hospital that shifted over to all vegetarian meals in recyclable containers, both for their staff and for like as patients were leaving. So there was the climate benefits of, as you all know, less greenhouse gas emissions per calorie from more plant-based foods, and some health benefits from more plant-based foods in people's diets. There was a project in Japan called Green Curtains, which is one of my favorites. This was after the Fukushima nuclear disaster. There was an energy crisis, as you know, in Japan. One of the projects was factories built what they call green curtains, which were edible vines that were grown up the south sides of factories. So they provided shade that saved energy, but they focused on vines that also produced fruits and vegetables that ended up in the cafeterias of the factories, and people could also take them home. And one more, I know these are a lot, but they're some of my favorites. We also did a scan. So those are all climate and health were kind of what we were looking at. We did a scan for climate resilience and climate mitigation. And one project there was called the Baltimore Orchard Project. And it was focused on a neighborhood in Baltimore that I know there's a different term like they used in the neighborhood. They didn't use this term, but the one that's coming to mind is food desert. So basically a place where it was difficult for people to get access to fresh fruits and vegetables. And it was a number of faith groups and youth job groups, and maybe the city was involved. I can't remember, but they planted orchards of fruit and nut trees, which had a job training component, nursery for these plants, and then planting them and then caring for them. Any green space in an environment that has a lot of impervious surface helps with flooding, and it also helps with the urban heat island effect. And many of you might know that in the US, if you look at maps of redlining and maps of the parts of cities where the tree cover is the weakest, those maps almost always line up. So there's a racial equity component to green space that most cities are grappling with right now. So this project, this was a minority African or a majority African-American community as well. So those are some of the examples. I bet many of you know Healthcare Without Harm, that organization. I know they're involved in a really interesting, to me, pilot project in the Bay Area that is helping a hospital as an anchor institution work with farms that are owned by BIPOC farmers, Black, Indigenous, people of color farmers. And there's like that SP Golador's project, there's an element of building a food processing component into that. And then the food is served in the cafeterias and the food system of the hospital.
Great. Wow. So more than one project.
Yeah, I think it's some of the most exciting possibilities, really.
Really.
Yeah.
And for those of you interested in kind of the macro look at this issue, our prior webinar, I think it was posted, I think it was last week, was all about how do we feed a growing population, almost 10 billion people in the next couple of decades, sustainably and healthfully at the same time. A really interesting webinar on that at a very global level. So there's some questions that have come in that I think relate to your comment that sometimes going slow is the way to go. At the same time, in order to engage people and ultimately be successful, but at the same time, we know that we have a public health crisis that requires emergent action. How do you kind of put those two together, that we really need to do something yesterday, and yet there are broad swaths of the community that we need to pull together in order to make the fundamental structural, cultural changes necessary in order to really pull this off?
Yeah. Yeah, that's the tension I live in every day. I mean, I've worked on climate change. Well, you saw those girls who are 21 and almost 25 now. They were babies when I flew off to my first UN climate conference. So I live with that urgency every day. I actually shifted where I put my life energy into this multi-solving approach because I got so darn tired. The thing I focused on before this was adding up pledges in the UN and reporting back year after year. We've made some progress and there's further to go. And feeling like despite all the urgency, that framing of carbon centric, just really looking at counting up the tons of carbon and not tracking all these other benefits didn't seem to me to be set up as a solvable problem. And so that brought me to this arena that we're talking about. And yeah, I feel that tension of one of our partner organizations is the Partnership for Southern Equity, and their founder, Nathaniel Smith, talks about moving at the speed of trust. And the speed of trust is its speed, and it doesn't go faster. So I have two quotes that hang above my computer that when I get in that, the tension we're talking about now that we're all sitting in between moving collaboratively and moving fast. One of them is from Wendell Berry, the American agriculturist and writer. And he said to a bunch of young people, he said, what you're in right now could be termed an emergency. And it takes great care. What you're in right now is an emergency. It's the type of emergency that calls for a lot of patience. And it takes a lot of character to be patient in an emergency. So I try to remember that. The other quote is from Grace Lee Boggs, so the Asian American civil rights pioneer, lived in Detroit, lived to be about 100. And one thing that Grace Lee Boggs said that really resonates with me is she says, it's not a matter of critical mass, it's a matter of critical connections. And that's the essence of multi-solving, right? What we say is that things that were not possible before become possible if you rewire systems, if you make there be these new connections. And so systems theory talks about how systems change. Systems theory says a system is a set of connected elements, and the behavior of a system depends on how the elements are connected. And if you want to change the behavior, the only way is to change the connections. That can be relationships, it can be rules and laws, it can be flows of information when people, a whistleblower changes a flow of information. But that's how you get transformative change. And transformative change can happen fast, right? Incremental change doesn't seem to be getting us where we need to go. So I'm holding out for transformative change driven by the power of forging new connections, and living in the uncertainty of exactly how that will play out, because emergent systems are by definition unpredictable, which is back to the other problem we were talking about how do we measure and show our impact.
Well, one example that some of the people on this call may be aware of, it's local to New Hampshire. I'm curious about your thoughts about these connections and actually getting things to happen. It's a group that has really tried to take on the issue of plastics. And they pulled together 10 specific cities that have all made kind of specific commitments within their cities. And so, one of our participants has thought about this same idea that if 25, that he's mentioned, say you chose 25 cities. I don't know if there are that many in New Hampshire, not many cities, but 25 towns and cities that were specifically targeted almost in a community organizing kind of way for multi-solving initiatives. Is that kind of focus, if you will, as opposed to kind of just letting these things happen organically? If a community organizing approach by groups such as yours or ours were taken, would that help catalyze and facilitate more rapid change?
Yeah, well, I think about this a lot. And in systems theory, sometimes we talk about coherence. And so I don't want to get too geeky on you all, but coherence has to do with patterns and with fractals. And it's the idea of simple rules or organizing principles that are replicated at lots of different scales. And so a classic example is the silhouette of a tree, right? Like you can tell a maple tree from an oak tree because with bare leaves, they look different. That's fractal, and the coherence is the angle between branches in an oak tree. Every branch has kind of the same angle if you study it, and in a maple tree, and they're different. So what does that have to do with plastics in New Hampshire? Coherence is a great force for spreading innovation. And these attitudes and approaches that I keep talking about and saying the replicable unit of multi-solving is how you go about doing things. It's a way of doing things, not a what, which is another thing I learned from Nathaniel Smith at Partnership for Southern Equity. And so that's actually a little bit of a relief that you don't have to, in my analysis, like orchestrate big complicated projects to get this all done. And a little town in northern New Hampshire could help a little town in southern New Hampshire by sharing the right thing, which is its attitudes and approaches, and that's not, well, here are all the people we invited, but here's the opening question. And this question broke the ice so much, or this question is where we really got down to economic inequity. And try that one in southern New Hampshire. So I think that I think the question is right on in the sense of connecting across scales and across sectors to learn and to accelerate innovation. But I think it could be pretty relaxed, not in the not serious sense, but in the not stressful sense, if that makes sense.
Great. Well, unfortunately, we're at the top of the hour. And
That went fast, at least for me. I hope it went fast for you all.
yeah, well, yes, it's been a whirlwind of information and great dialogue, and we really appreciate yours taking your time. And I really hope people do go to your websites. They're fabulous toolkits, resources, Climate Interactive, and learn more about Multisolving Institute. And I hope all of you will come to our website. Maybe Emily, you could put it in again, and just note that we have several upcoming webinars planned. Bob, did you want to say anything about our organization or the next webinar?
I think I'm all set. I made a few comments in the chat, Bob.
Okay, great. Well, with that, I will bid you all a good night, and let's go forth and make the world a better place. Thank you very much, all.
Thanks again,
Bye-bye.
everyone. Bye.